Hi all, hope each and everyone is doing well and good, and it is me Dr. Amrita here. So today we are going to discuss about the most important topic and the most chance question. And I guarantee you guys, if you study this much, of course you will definitely going to get above 85 percentage of questions from microbiology. And if it's going to start, I will say that first start with mycology because that is very important. Say last year, last question, Neetpg, you have seen a question related to like mycology. That is more than four questions they have been asked. That desert rheumatism, wala, and all those things, camel in the desert. And what was the answer? Yes, it was coccidioidomycosis. And there are so many people actually confused with that question because you have read it but you haven't revised it. So, like at the time of examination, you were confused whether it is paracoxy or this coxy. See why that happened, because there is no revision at the last moment. So always remember, just revise your previous year, what not you're following, just revise your primary source because that is very important. Okay. And also that Northern America, Southern America, that Darling's disease, what is a Darling's disease, like histoplasmosis with TB, they have asked in 2023. So from this you can understood that yes, this is a key area for the examiners for asking questions. They have asked like a cryptococcus also, they have asked since 2023. Another one, aspergillosis, they have asked. So in this, from this area, so many questions from 2019 onwards. So this is a pocket area for asking questions. So if you're going to study some unrelevant topics so long, taking your 2 hour 3 hour, and if it doesn't ask in examination, is it any point? No. So at this last moment, it is always important to study the topics that is going to definitely come for examination. So these are the points, the key points for success, because each and every marks is going to count. You all know that one digit mark, if you lose, if you like one negative mark, is going to create a big shift in the rank. So it's very important, each and every mark. Okay. So first do with mycology, then come to dermatophytes because that is also very important. 2022 we have seen a question like this all thing, that is what epidermophyton, microsporum. That's all you want to learn the diagram, as well as where is it involving the skin, hair, or nails. That is very important. Spindle shape is what, pear shape, club shape is what. That is going to be important. So study the mycology very well. So if you're planning to start with mycology, start with this mycology, because mycology, which QB you are using, please do it. Please work well. If you're doing marrow, yes, that question bank is amazing actually. Please do all questions related to this, that cryptococcus wala, Raynaud's phenomena, sporotrichosis. Every time 2022-23, a question will definitely. Cartwheel appearance, that aspergilloma, that fungal ball wala, and all very important. Pneumocystis jirovecii pneumonia, very important, as well as the treatment part is going to be very important. Please never skip it. Okay. GMS wala, ping pong appearance, where do you see? So these things you want to diagram. Like in micro, you want to study those diagrams and you want to learn. Okay. That is chromoblast, that is thing, na? That cauliflower wala, chromo wala, that is very important. Please never skip it. Yes, after learning the mycology, just move to parasitology. So mycology, then this dermatophytes, then go to parasitology, because all time favorite. That is DRDF, very important. That Chagas disease, as well as they used to ask every time one question from either malaria or filaria. So that's very important. That filaria, buga, that at end where nucleus is present, nucleus is absent with diagram, please learn it. That trypanosoma, that is going to be very important. That fatty diarrhea, they will be foul smelling, like this fatty diarrhea, malabsorption, steatorrhea. That's all clinical features they are going to ask. So microbiology is better to do the MCQs, okay? Because mycology is the area, superb scoring area. So never ever skip it. Yeah, that nematoid, cystoid, echinacea, and all those things. See what floats in this thing, Bilstein index, and all those some codes are there. Please do learn it. And also in parasitology, what is important is the eggs. Identifying the eggs is very important. What is which one float? That's all things very important. Operculated eggs with diagram. Please learn it. And yes, after parasitology, just go with rickettsia. Rickettsia is very important. They can integrate with PSM and they can ask. So parasitology is very important. At the same time, it is very easy. Na? So yes, rickettsia, go with rickettsia. Then move with AIDS and HIV. AIDS and HIV, because 2022 we have seen a question, 22 and 23 they integrated with HIV and so many questions, so never skip it. As well as that hepatitis, see past 2 years we are not seeing questions, but we can expect if they want they can definitely ask. So please don't skip that. Hepatitis wala, see what all this, that antibody, that there is a thing, na, immunization, what happens, like winter period, what is constant. There is a like post vaccine, what do you see, like anti-HBs, like that, acute infection, IgM. That's there is a table you will be knowing with the diagram. Please learn it. Okay, that is going to be important. That AIDS and opportunistic infection is very very important. That I have already said that Indian ink stain, that is all those cryptococcus voila, GMS ping pong appearance, that is going to be very very important. Toxoplasma gondii, like the CD4 counts less than 100 in where, like 50, 100, that's all very important. Please never skip it. That Jirovishi, what is that treatment voila, and this is going to be very important. With that CD count, please learn, don't skip it. So after learning that, just go to virology, because virology very important. Virology, that structure voila, just read and go. That's mumps and all those is rotavirus. Measles is all time favorite because they used to integrate with PSM and they used to ask. So just do with virology. Then go to the culture media. Culture media that you want to learn, like what all culture media, this thing. Virology, that parvovirus, that Condyloma accumulatum HPV, which is like carcinogenic and all those things. Bacillary this angiomatosis, that was asked once. So which grade, like HHV8, like that they'll be going to ask. And also all time favorite is whether like CMV, where you see that periventricular calcification, that is going to be important. Molluscum contagiosum, one time 2022 they have been asked, so never skip it. Rickettsia I have already explained, please don't skip it because they can integrate, because PSM also there is a topic, microbiology also topic, so never skip it. And also the other thing, just before studying bacteria, first you should learn bacterial toxins. That is where do you see like increased cyclic AMP, that cyclic GMP, heat stable, whereas there is one thing as heat stable is in cholera, anthrax, E. coli, pertussis, and all those things. So increase GMP, where do you like stable E. coli, that's all thing very important. Where do you expect to see increase F2 by ADP riboxylation, that is very important. That is Pseudomonas, because that table is going to be very very important. That bacterial toxin voila, that what inhibits the 60S, that's all thing very important. Please never skip it. Then go with this diarrhea and food poisoning voila, diarrhea that you will be knowing. Say that enterotoxogenesis recall, where you see enterohemorrhagic, what EHES, enterohemorrhagic voila, that's all important. And also that in fried rice, what you say, like bacillus cereus, very important. Antibiotic, that Clostridium difficile is all time favorite question. This time you can definitely expect a question like rotavirus, rice water institutes, pediatric children, say like that food poisoning, like 1 to 6 hours, what is, that is very important, very very important. That hours, based on the hours, which bacteria, that is very important, because there are so many clinical scenarios in the Q bank. Please do it. And in culture media, very very important, just identifying which culture media, like cholera, what all culture media, that's all. Neisseria, what all things, that Waterhouse Frederick, that's all things. It's a gram negative. and all those things. Please learn. See, it's not that you want to go with deep, that important bias you want to definitely learn, like where do you see reverse cyclic AMP and all those things. Clostridium preferences all time favorite. TB wala just read bacillus anthrax, what do you see. Then satylism is very important. Borrelia burgdorferi, that is important. Syphilis wala, what is this leptospirosis 2021 22 they have asked that syphilis wala Hutchinson's, what is the triad. So always remember, it's very important that's cultural media, what is like catalyst positive, and that Clostridium diphtheria, what all this media is very important. The Tinsdale, McLeod, that's all very important. So where do you see Skyros, Skiro, like sparrow, Skiro, Scampylobacter. That's very important. BZYE media. That's all very important. Salt, milk, Wilson and Blair, all time favorite. Salmonella. That's all things. Just read and go. Okay. Castaneda, ash down, and all those things very important. Palcam, Robertson Cooks, CLED, and all those things all time favorite. EMJ, H media. Please read. Please do it with MCQs. That is very important and point of micro. And also last read about the sterilization as well as that hypersensitive hot air oven autoclave, that is going to be important. So I assure you guys, if you study this much, of course you will definitely rock. And also you want to do the case scenarios, because they used to frame cases and ask. So never ever lose your hope. Yes, of course, you can defeat this battle. So time is there. Actually, don't get nervous. See, if you're thinking about like, oh my God, like what to do, how am I, will I get my dream branch? You will become disturbed. Please never ever think about the outcome. Never think about the outcome. What you can do is study. So just study and pray to the divine grace will definitely help you out. All positive things you are doing, it will get resolved there. And at the time of examination, it will definitely show. And thank you all. And it's me, Dr. Amrita here. If you guys want me to put some other subjects, please do comment in the comment box. Thank you all.